Now with a GMA Health Alert on nutrient deficiencies. Even if you eat a well-balanced diet, you could still be lacking some key nutrients. Dr. Darien Sutton is here to explain how to spot the signs and what you can do about it. I have to ask, who is most at risk for nutrient deficiencies, and then what do we do?
Yeah, millions of Americans walk around with nutritional deficiencies, and many don't know about the symptoms, and many don't realize that a lot of the answers to their symptoms are right in front of them in the grocery store. There are certain groups, as you referenced, that are at higher risk. For example, those with chronic kidney disease, those with malabsorption problems, irritable bowel disease, where they can't hold on to the nutrients, and even those with use disorders, like alcohol use disorder, that can increase your risk. So it's so important to ask. Many of these, you might see signs on those basic blood tests, but you do have to specifically ask. When I'm talking to my primary doctor, I usually add on these levels to understand where they are.
Right. Let's talk about vitamin D, because a lot of people have sort of insufficient levels of vitamin D.
Hey, about 40% of people estimated have vitamin D insufficiency. So what does vitamin D deficiency look like? It can be variable. It can mimic many different things, often fatigue, sometimes anxiety, even depression. Hair loss is probably a more common finding, as people find that in their workup. The main question is, where can you find it in the grocery store? So vitamin D is often in fatty fish like salmon and tuna. You can even find it in fortified foods, but to be honest, it's difficult to get enough vitamin D just from that. Yes, sunlight is helpful, but you want to protect your skin. So I think it's perfectly reasonable to get a supplement. If you're going to get one, choose vitamin D3. It can be confusing. There are a lot of options.
Right.
And everyone needs a variable amount, 600 international units to 800. But if you read the instructions and follow the instructions, you'll get what you need. One tip, taking it with magnesium can help with absorption.
But like more in winter then too?
More in winter, especially, 15 minutes of sunlight, they say, can help you get that vitamin D. But of course, you want to wear protective sunblock or sunscreen to protect your skin.
Let's also talk about iron.
Yeah.
That's another big one. What can people do to make sure they're getting enough?
A big one, especially for women between the ages of 15 and 49, mainly because iron loss is due to bleeding. So menstrual bleeding is a big cause. In the emergency room, I'm often talking to patients about this. So what does iron deficiency look like? Many times it can look like depression. You don't want to get up. You're too exhausted. Many times it can also look like your exertional tolerance is difficult. For example, when you get up to go run, you're already out of breath before you even start. Those are signs of iron deficiency. You want to talk to your doctor. Also, brittle nails is one of those common findings. So
cold hands.
Cold hands.
Why are they so cold? Iron deficiency.
We'll discuss it during the break and examine her fully. But iron deficiency, where can you find iron in general? In most meat products, poultry, for example. But for those who might get it from greens, just remember that your iron is more easily absorbed from meat than it is from leafy greens. So one tip, taking it with vitamin C if you're going to eat leafy greens, bell peppers, citrus, that can help with your absorption of iron.
I'm just blown away by Elsa over here.
It never bothered her anyway, don't worry.
Exactly.
Finally, a big one, B12. That's such
Huge
a
one.
hot topic, and I feel like in my blood tests over the years, it's been one that they're looking for. So what do we need to know?
Such a hot topic. The most important thing to know is that it's really difficult to get vitamin B12 deficiency because it's found in most animal products. So the patients that I focus on are those who are strictly vegan. Those patients are the more at risk for vitamin B12 deficiency. You only need like 2 micrograms of vitamin B12 to be sufficient. So it's really not a lot, and you'll find it everywhere. But the symptoms can be, think nerves. Vitamin B12 is important for protecting our brain health and our nerves. So if you feel pins and needles or neuropathy, or you're trying to get to the bottom of it, you might want to check your vitamin B12 level.
You were saying that this is a top first date question.
It is a top first date question. Thank you for bringing that into the segment. No, it is. And one of the reasons why I'm so good at doing this is because I've been on a couple of first dates. So here we are.
Let's get him a last first date. That'll be our next segment.
Yeah, right? Thank you so much, Dr. Sutton.